So Jim, how are there different ways that PER and PTCE could collaborate to improve patient care?
Phil, I love collaborating with PER, and I don't think every activity needs to be a collaboration with physician, nurse, and pharmacist. I think there are certainly activities that are focused on physician and diagnosis and treatment that have to be focused on that information, and pharmacists are involved downstream a little bit more, but there are opportunities that we can bring pharmacists, nurses, physicians together when it's appropriate, that they are part of that healthcare team, and when there's information about adverse drug event monitoring and being able to address that by the pharmacist, being able to coach them through adherence issues. That's really important for that pharmacist to be involved. The other thing is the pharmacists need to be involved in hearing from the physician and from the nurse is what information is important for them to provide back to that healthcare provider, and how should they do that. And oftentimes you hear that from the physician and from the nurse that they don't hear from the pharmacist as much as they can. And I think that's important. If we're going to look at the patient and treating the patient, that pharmacist is important to provide information back to that physician and nurse.
Well, I think multidisciplinary care is really the future of care, right? Everybody on the team is providing their own specific role on the team. You have your physician, your pharmacist, your nurse, your PA, your patient as part of the team, and they're all working together for the common goal, which is to improve patient care. So just like any team, whether it's sports or life or anything, you do have your specific opportunities to work together. So let's say in football, you have your offense that's practicing with the offense, you have your defense practicing with the defense, but then you also have the whole team coming together and practicing together because they're all trying to do the same thing, like winning a Super Bowl. If they're all working on it together and being educated together, they're going to go out there and play in the game, which is really a game. Patient care is not a game. But that's the big event to make sure that you're improving the lives of these patients. So yeah, there's an opportunity for unique, individualized, specialized education, but you can't forget about the importance of educating the healthcare team, which is really done through great collaborations, like with PER and PTCE.
Oh, that's well said, and I agree